I showed a front page story from the Washington Times about concerns by some Democratic governors about the shifting of a new population to Medicaid rolls and adding to the unfunded mandates and responsibilities for payment by the states.
Well, I think we have to help those states. My state, for example, Illinois, is $11.5 billion upside down in deficit spending, and I just met with the governor yesterday with our delegation, and he's concerned about that, and we have to help them out with it. But, you know, again, I think what we have to remember is a lot of this is the strain that's been put on the states is because they're having their own financial problems as it is, and this is a recession that we're trying to come out of, and I think we're coming out of it, albeit I will tell you way too slow from my perspective. But we've got to be able to help our states, and I think that we can. And I think once we can get this bill through, you know, look, this bill doesn't take effect until 2013. You know, when we first passed Social Security years ago, it wasn't the end-all, be-all. They corrected it as they went down the road, and we can do that as we see how this bill unfolds. And so I think we're going to be okay with our states. Our governor is very optimistic that we're going to have a lot of Illinoisans covered under health insurance, and in my district alone, 40,000 people are going to have health insurance that currently don't have it, and that's a huge drain on our hospitals. If I could just say one thing, one rural hospital in Monmouth, Illinois, to put this in perspective, 3 years ago, they had $400,000 in charity casework. The director of the hospital said the following year it went up to $1.3 million. And this year, Monmouth Hospital, Monmouth, Illinois, a town of about 13,000, is going to have $2.8 million in charity work. That's gone up from $400,000 to $2.8 million in 3 years. If anybody doesn't think we have a financial problem out here on health care, they need to go to Monmouth, Illinois.